Hi guys, welcome back. So today I'm joined by my friends Hassan, Dr. Hassan and Dr. Onkar, and today we're going to be talking about reasons why you shouldn't be a dentist. And there's a lot of videos out there explaining why you should do dentistry, but I think it's really important to just have an understanding of, the characteristics needed and why you might not want to do dentistry. So I thought it'd be a good chat with all three of us here today. I'll get them to introduce themselves. So Onkar.
Hello, hi Yewande, thanks for having me on your YouTube. This is my first YouTube video. So I'm Onkar, I'm currently a dental core trainee in oral surgery and maxillofacial surgery at University College London. I also do some associate work in a normal dental practice in Essex, in Brentwood, near where I live. So a bit of everything at the moment. So yeah.
Hi, thank you for having me on. So my name's Hassan. I'm an associate, so I'm working as a dentist, and I've got a keen interest in cosmetic and restorative dentistry. I'm working down in southwest London. I graduated in 2018, and since me and Yewande met up, and through social media and Onkar as well, we've just been talking. And, we're here now.
Yeah. Today's actually the first time we've met in person. We've been speaking for a year online, so it's actually quite good. So yeah, we'll go straight into it. So I think the first reason why, if you're thinking of doing dentistry and you think it's easier, then I think that's a big reason not to do it, because a lot of people say that dentistry is easier than medicine. I remember when I was applying, some people put dentistry as an insurance, as a backup option for medicine. So if you're sort of torn between the two and you're thinking dentistry, it's going to be easy, then I think that's not a great reason. Do you guys agree?
100%.
Completely agree. So it's
because we need to know the theory and then also apply the practical. And doing both in combination is actually quite challenging, isn't it?
Exactly. And it's 5 years. Medicine's 5 years and dentistry is 5 years as well. So we actually have to learn a lot. So if you think it's going to be an easy ride, then you're going to be in for a shock. So if you think it's easier than medicine, don't do it.
Don't do it.
What's mad is how medics always say to us, it's just teeth. Like,
Oh my God,
teeth.
yeah.
5 years learning about teeth.
It's not just about teeth. The amount of times people say, why is it 5 years? Are you just not learning about teeth? I'm like, oh my gosh, no, we have to learn about anatomy, we have to learn about the body.
And then apply it.
To other things. We had 2 years of teaching with the medics. Like our first 2 years at uni was all common learning. And then we kind of specialised in the mouth and teeth. And there's science behind it as well, like dental materials, things people don't think about, chemistry, all the A-level stuff does come back to haunt you. So it's not just teeth.
That was the worst thing about dental school.
Chemistry does come
ligands
back.
and bonds and covalent.
So you're going to learn a lot. It's not just about teeth.
It's not just that,
if you think you're just going to be learning about teeth, then maybe dentistry's not for you. Number two, what do you think?
Number two, I think there's this sort of, I would say, myth that dentists earn a lot of money when you come out as an associate or as a dental graduate. Unfortunately, that myth is not true. There is so many hidden costs and things that you have to take into account. And I mean, earlier we were discussing courses and equipment, etc. These are all things you do have to fund yourself. And if you want to go into further training, if you want to do courses that are more advanced in terms of university settings, if you want to specialise, if you want to do a master's, these cost a lot.
They cost a lot. Even like doing nice treatment like Invisalign, you get charged to do the Invisalign.
you
It's not
have
just
to
quick
pay
money.
to
You've
do
got to
these
pay to do
things,
Invisalign. You've got to get the lab fees. There's so much cost that we don't think about.
People think that you're going to just drive a Ferrari after 1 year being a dentist.
If only.
And the amount of people that I say, I'm a dentist, oh right, you must be so rich. I'm like, no, obviously it is a good career. You're not going to be poor, but I think if you're just thinking about going into dentistry just for the money, you're going to be quickly disappointed.
Do actuary.
Do banking. There's other careers.
Do finance.
Or just invest in Bitcoin or something.
There's other ways of making money. Let's just say that.
There's other ways of making money.
So if you
I think dentistry can be extremely rewarding, but at the same time, it's not. You shouldn't apply. You shouldn't apply to be a dentist for financial motivation, because you will essentially. You will fail.
You
have to have a passion for it, because literally, if your main thing is I'm applying for dentistry because I want to make money, you're going to quickly realise in dental school that why was I here? And people swap courses, and you don't want to be that person that you did not go into it for genuine reasons, and then you're just disappointed.
That's so true. can be seen through quite early on as well. So I think it's important to have a passion for it. Yeah. Reason number 3 is you shouldn't consider dentistry if you're not a very social person or you're not considering yourself a people's person. Now, why we say that is because an average dentist may see 15 to 30 patients a day. You're in a room with your patient and your nurse, and it's quite a social profession, am I right? You see, you're talking to people all the time. You've got to make chat, so you've got to remember things about them, have the skills to do the soft talk, and also be able to talk about clinical things as well. So being a people's person is important because you want your patients to like you, and I think like if they don't like you, it makes them feel not on edge straight away. So being someone who's social is really important. If you're someone who prefers a numbers job or something that is more intensely on your own, I think definitely not.
I think as well, it's not only just with your patients, it's the whole team.
The whole team.
You need to be able to communicate and talk to your nurse, who becomes your best friend, by the way. Your receptionist, who's one of your really
lifesavers.
Your lifesavers, and everything will go through them at the end of the day. So these are 2 pivotal people, and then you've also got your technician, the boss, and these are a number of important factors which basically make you a successful dentist, and you've got all this spider web of communication going on, and in the middle of that is your patient, really, isn't it?
Yeah. I think like being a dentist straight out of dental school, it's very like we're quite lucky that it's very similar to how GPs work, and it takes them additional training to become a GP, but we're lucky that we go straight into like a GP style job, where like one minute you're seeing a 3-year-old, then you're seeing an 85-year-old. So it's very flexible.
You have to know how to manage different kinds of people. So if you're somebody that's quite timid, you don't really like talking to people, you like to be by yourself, maybe, like, I'm not saying that you can't be shy, because you can grow your confidence, but I'm saying if you're applying to dental school and you just don't like talking to people, then that's not going to work in a career in dentistry, unfortunately.
Your clinical skills is very important, but your communication skills are just as important.
If not more.
So yeah, guys, those are the 3 main reasons why if you're applying to dentistry, you shouldn't do it. There's lots more, but I think anything else you think is really important for them to know about not doing dentistry?
It is stressful.
If you can't handle stress, then maybe
get out of the kitchen.
And you're getting yourself into, as we were discussing this earlier, it's not just a job; it's a lifestyle sometimes. Be ready to make sacrifices. Sacrifice your evenings. You're gonna be lifelong learning. That's what dentistry is. So you have to be up for that, and just really be ready to just take on the challenges. I mean, we still love it though.
We love it.
I love it.
It's not meant to be a negative video, because we love our career, but I just wanted to be honest with you guys and let you guys know that it's not all sunshine and rainbows. You will be stressed. Unicorns. You will be stressed, and these are the factors you have to consider before applying.
I think you build a thick skin in uni very quickly. Like, you can't get too caught up on every criticism you'll receive, because it makes you a better clinician. So remember to take every comment with learning. So like, realize why it's being said to you, and like, I think as the years get by, it gets easier.
100%. You learn. Dentistry is all about learning. Each year you're a dentist, you're going to be learning every step of the way. But yeah, if everything we said sounds like you and you feel like you can handle all of that, then go for it. Apply for dentistry. Apply. And honestly, I wish you guys all the best with your application, like I always say. If you need any help, can they contact you?
Of course. You can
what are your socials?
So I'm known as the Bearded Tooth Fairy on Instagram. Feel free to drop me a message. I'll try my best to get back to you. I don't like to direct message. I'll voice note you. Quicker and easier.
I'm on Dr. Onkar Mudhar on Instagram and on TikTok, so you can find me on.
He's a TikTok star.
Find me on TikTok. So either or. So Dr. Onkar Mudhar, happy to help.
And you know where to find me, Dr. Dental on Instagram. But yeah, hope you guys enjoyed the video, and yeah, hope you found it insightful. Like, comment, subscribe. He's always wanted to say that. Can you tell?
You forgot the below.
Below.
Below. Yeah.
All right, then. Thank you guys.
Thanks.
See you next time. Bye.